been getting a lot of questions lately about deep plane facelifts, so I wanted to talk a little bit about the procedure itself and why it seems to be becoming so popular lately. There's been a lot of talk about it on social media. If you look at social media, you would think that 95% of facelifts across the country are being done in this fashion. In truth, only about 5% of facelifts across the country are being done that way. And it's not because only 5% of the surgeons in the country are capable of doing it. It's more of a marketing tool, I believe. This entire thing sort of falls into the category of everything old is new again. The first ones of these were being done back in 1991 to 1993 time frame, and everybody thought it was going to be great because the people who initially described it said that the results were better and they would last longer, and so a lot of people started doing them, and it turned out neither one of those things was true. They tended to have higher complication rates, and some of those complications were serious. It was things like injuries to the facial nerves that control your motor muscles in your face, higher rates of hematoma, which is blood collections under the skin and under the muscle, prolonged bruising and swelling, longer operative times, more post-operative pain. So a lot of things that are kind of a big deal to a lot of people. And so it sort of got abandoned and fell out of favor. I know a lot of the newer surgeons are starting to do it again because they weren't around for those complications. But most of the surgeons, including myself that have been doing these for a long time, prefer to stick with the traditional facelift. Interestingly, there have actually been some studies done on this to see if they truly are better and last longer. And there was a great study that was done on identical twins, which one of them had the traditional facelift and the other had a deep plane facelift. You could not see any difference, and they did not tend to last any longer in that entire study. The other study that was done had patients that actually had facelift of the traditional sort on one side and deep plane on the other. I'm not sure who would volunteer for that, but they actually did this study, and the results were found to be no different at 6 months or a year. So I don't understand why anyone would take on additional risk of complications with more pain and a prolonged healing period for no change in the end result. So I just don't think it warrants the extra risk, and I prefer a traditional what they call SMAS, capital S-M-A-S facelift, which repositions those deep muscles of the face and the overlying skin independently. And I just think, like anything else, the technique that you know is going to give you the best result. And if I can do that in the safest manner possible, that's what I'm going to do. So if you've got further questions on this and would like to talk about it, I'm happy to look over things with you and give you my opinion on what might benefit you, adjunctive non-surgical things that we could do if you're trying to push it off a little bit further down the road, and figure out a plan for you that works best for you. Take care.